Today, all 193 members of the United Nations will sign a declaration agreeing to fight what they call the biggest threat to modern medicine, germs that are resistant to antibiotics. The declaration calls for developing new ways to treat illnesses, increase awareness about the problem, and find a way to pay for it. The UN has only taken on a health issue three other times. It's in 70-year history. AIDS was one of them, Ebola, and now non-communicable diseases. Experts say the problem is getting worse, but what can you do about it? The Now's Tara Molina is getting answers.
Antibiotic resistance can mean more time in the hospital, increased medical costs, even death. It's a problem across the world, but according to a doctor I just talked to, there are simple things you can do at home that can actually help. Dr. Stephen Gordon has studied infectious disease for years.
It's a global problem, but
he's chairman of the department at the Cleveland Clinic.
But like many things, it's got to be handled locally.
And he tells me, well, antibiotic resistance is not new.
We have had emergence now of some bacterial diseases that we really have limited or no options.
More than 700,000 people die every year because of drug-resistant infections. A recent study projects by 2050, antibiotic resistance will kill more people than cancer. Experts say there's more than one reason for the problem, from overuse of medications to increased antibiotics in our food. And Dr. Gordon says there's a lot to be done.
So it's not going to be one solution.
But you can help, targeting the threat in simple ways at home, like washing your hands, covering your mouth, and keeping up with vaccines.
The flu season is just around the corner.
Another one, know what you're taking and why. Dr. Gordon says misuse of antibiotics isn't good for anyone.
Do I really need the Z-Pack, or maybe what I really need is just to alleviate the symptoms and signs of a cold?
A lot of what the United Nations is doing today revolves around drawing attention to the problem, recognizing the threat, and then coming up with solutions that can work globally. Reporting for The Now, I'm Tara Molina.